this video, we are going to explore how to manage this prevalent health condition, type 1 diabetes. What is type 1 diabetes? It is a medical condition in which the pancreas does not produce insulin. Insulin is a hormone that helps the glucose to enter into body cells. Firstly, we should know how insulin works in human body. When we eat something, the blood sugar level increases in our body while the pancreas releases insulin at the same time. Insulin molecule signals the body cells to absorb glucose from the blood and use it as energy or stored as glycogen in the liver and muscles. This process helps to maintain the blood sugar level in human body. In the next slides, there is a symptom of type 1 diabetes. Number 1 is the excessive thirst. Number 2, hunger. Number 3 is the weight loss. Number 4, type 1 diabetes patients mostly suffer from fatigue. Number 5 is the slow healing of cuts and wounds. And number 6 is the vaginal yeast infections. These are those common symptoms which are typically appear in the type 1 diabetes patients. If someone is diagnosed with type 1 diabetes, it can typically undergo the treatment which includes some following points. Use insulin injections regularly. Diet and exercise. Oral medications is very important. Avoid sugary products. Regular checkups. Glucose monitoring. And the last one is the stress management. Type 1 diabetes treatment focus on insulin therapy. Patients often use insulin injections or insulin pumps to regulate the blood sugar levels. By monitoring the carbohydrate intake, regular exercise, and close collaborations with healthcare professionals for a regular checkups, these are very crucial components for the effective management of type 1 diabetes. In the next section, we are going to explore how we can prevent from type 1 diabetes naturally. How we can manage the diabetes through our diet and lifestyle. The number 1 is the high fiber foods. High fiber foods are rich in plant-based substances that our body cannot fully digest. These foods, such as fruits, vegetables, whole grains, promote the digestive health and also help to maintain a healthy weight and can assist in managing the blood sugar levels. High fiber foods included in our diet is beneficial for various aspects of health including digestion, weight management and blood sugar control. High fiber food includes whole grain, pea, vegetables and blueberries. The next one is the low carb diet. A low carb diet is a dietary plan that reduces the consumption of carbohydrates and highlights the intake of protein and fats. This type of meals has been related to many health benefits including weight loss and improved sugar levels in human body. Low carb diet meals include the following nutrients: protein, starchy vegetables and dairy products. The next one is the lower glycemic index. The glycemic index measures how quickly a carbohydrate containing food raises blood glucose level. Food with a lower glycemic index are generally considered to cause a slower and more gradual rise in blood glucose as compared to those with a higher glycemic index. A lower glycemic index can be beneficial for individuals, especially those with diabetes. And it is include cabbage, chickpeas, red beans and carrots. The fourth one and the most important one is the restrict white stuff, means avoid sugary products. White foods, particularly refined carbohydrates, often have a higher glycemic index and are associated with the high sugar levels. By reducing the intake of these foods may be beneficial for managing the blood sugar, maintain a healthy weight, and improves the overall health. The white stuff products include white bread, white pasta, white rice, and sugar. If someone is fail to accurately diagnose with type 1 diabetes. It may result in a very life-threatening condition known as diabetes-related ketoacidosis. Firstly, we should know about what is diabetic ketoacidosis. It is also known as the DKA. It is a medical condition that occurs when the body does not produce sufficient insulin to enable blood sugar to enter into human body cells. Without insulin, the body begins to break down fats for fuel. Due to this reason, there is a production of acid in the bloodstream called ketones. DKA, diabetic ketoacidosis, is a serious medical condition that requires immediate medical attention. In the next slide, you can see the causes of diabetic ketoacidosis. The first one and the most common one is missing insulin doses. Infection, stomach illness, taking medicines such as steroids, heart disease such as heart attack. The people with type 1 diabetes are at higher risk for ketoacidosis since their bodies does not make any insulin, while the type 2 diabetes patients also have DKA, but it's a rare condition. Type 2 diabetes people are insulin resistant rather than insulin deficient. Diagnosis of DKA, diabetic ketoacidosis, and type 1 diabetes. Type 1 diabetes is diagnosed by the following test. The number one is the blood glucose testing. In blood glucose testing, a small sample of blood to measure the amount of glucose which is present in human blood. Typically done with a blood glucose meter, this test helps the individual with diabetes to monitor their sugar levels. The second number is the hemoglobin A1C test. It is also known as HbA1c test. It measures the average blood sugar level over the past 2 to 3 months. The next one is the autoantibody test. This test is used to detect the antibodies which are produced by the immune system that targets the body's own tissue. And now the turn is the DKA test. How we can diagnose the diabetic ketoacidosis condition in patients. By performing these tests, we can detect the ketone levels and the serum beta hydroxybutyrate levels in human body. The number one is the glucose monitoring and number second is the ketone testing. A ketone test measures the presence of ketone in the human body, which are the byproducts of the fat production. When the fat is break down, there is the product are released in the human body is the ketones. Commonly used in the diabetic management, it helps to assess whether the body is using fat for energy, indicating a potential issue with insulin levels. The last one is the serum beta hydroxybutyrate test. It measures the concentration of beta hydroxybutyrate in the blood. The last section of this video is how we can prevent from the diabetes related to ketoacidosis. There is some prevention strategies. The number one is to manage the blood sugar levels. Testing before meals and bedtime is very important. Eat regular meals throughout the day. Drink fluids to prevent dehydration. Do not skip insulin doses. Exercise can help to regulate the blood sugar levels and improve the insulin sensitivity in human body.